Hello and welcome to another edition of Health Matters. I am your host. My name is Dr. Michael Chillemi. And on this episode, what we're going to do is we're going to talk about revolutionizing weight loss, where we're going to dive into the deep world of the cutting edge weight loss solutions today. So in today's revolutionary weight loss, we're going to talk about the power of Mounjaro, which is a tirzepatide, versus Ozempic/Wegovy, which is a semaglutide. In this episode, we're going to unpack the two most powerful medications on the market today, Mounjaro and Ozempic and Wegovy. So whether you're considering these medications for your weight loss journey or simply curious, this episode is a complete guide. Also, if you have friends or family that are thinking about doing it, please stay tuned. You can help somebody, give them some great information. Okay, so understanding the nuances of these medications, including who's an appropriate candidate, what blood tests are going to be needed, how do these drugs actually work, what are some of the common and uncommon side effects, and what are the strategies for long-term success? And that is part of the essential blueprint for these medications. So without further ado, let's delve in to every aspect of these medications. So first, we're going to talk about understanding Mounjaro, which is a tirzepatide. So the way Mounjaro works is it's a dual agonist of the GIP, which is the glucose-dependent insulinotropic polypeptide, and a GLP-1, which is a glucagon-like peptide 1 receptor. So what's a dual agonist mean to me? A dual agonist refers to a compound or drug that can simultaneously stimulate, activate two different pathways or receptors in the body. This type of medication can offer therapeutic benefits by targeting multiple mechanisms of action. Dual agonists require modulation of more than one pathway for effective treatment. So the way it works is by increasing insulin secretion and inhibiting glucagon release and slowing gastric emptying, all of which contribute to reducing your appetite and promoting weight loss. Okay, that's Mounjaro. Now let's talk about Ozempic and Wegovy, which is a semaglutide. Ozempic and Wegovy are both forms of a semaglutide, which is a GLP-1 receptor antagonist. These medications primarily work by mimicking hormone GLP-1, which regulates appetite and slows gastric emptying and enhances insulin secretion. So the question begs, what is the difference between these two medications? What is the difference between Mounjaro and Ozempic and Wegovy? So Mounjaro, which again is a tirzepatide, and Ozempic and Wegovy, semaglutides, are both injectable medications, right? You have to inject them weekly. And they're typically medications used in the management of type 2 diabetes and for weight loss. But there's some important differences in their mechanisms and approvals. So let's get into it a little bit. Mounjaro, again, the mechanism of the action is being that dual antagonist, right? So we're going to activate both the GLP-1 and the GIP receptors. Both of them allows for potentially greater reduction in blood glucose levels and body weight. So the FDA has approved Mounjaro specifically for the treatment of type 2 diabetes. While it has showed promising results in clinical trials for weight loss, it is not yet approved by the FDA for the sole purpose of weight loss. Efficiency. Studies suggest that Mounjaro may lead to greater weight loss when compared to the semaglutides, the Ozempics, and the Wegovy, although head-to-head clinical trials are required to confirm. Okay, Ozempics and Wegovy semaglutides, they both have the mechanism of action for both of them contain the same active ingredient, which is the semaglutide, which is the GLP-1 receptor antagonist. Semaglutides work by mimicking the GLP-1 hormone, which helps regulate insulin secretion and appetite reduction. FDA has approved Ozempic for managing type 2 diabetes and for reducing the risk of major cardiovascular diseases. Wegovy, on the other hand, is approved specifically for chronic weight management and in addition to being a treatment for type 2 diabetes. Efficiency. Semaglutide has shown to significantly improve the glycemic control and induce substantial weight loss. However, weight loss efficiency might be slightly less than Mounjaro. So what are the key differences? Okay, key differences are this. Receptor targets. Mounjaro acts on both the GLP-1 and the GIP receptors, potentially offering a broader band, while Ozempic and Wegovy only targets the GLP-1 receptors. Okay, number two, FDA approval for weight loss. Only Wegovy, which is the semaglutide, is approved exclusively for weight loss. Mounjaro, while it's effective for weight reduction, is not yet approved specifically for the use of weight loss. Weight loss efficiency. Preliminary data indicates that Mounjaro may induce greater weight loss when compared to the semaglutides of Ozempic and Wegovy. Okay, let's get into who is a candidate and why. Ideal candidates for either one of these is an individual with a body mass index of 30 or higher, while individuals with a BMI of 27 or higher with one weight-related comorbidity, which is like type 2 diabetes, hypertension, dyslipidemia, and individuals who have not yet achieved adequate weight loss through diet and exercise alone. Okay, who's not a candidate? Individuals with a personal or family history of medullary thyroid carcinoma, MTC, or multiple endocrine neoplasm syndrome, type 2. It's called MEN2. Also, who's not a candidate? Those with a history of severe hypersensitivity to the active substances in both medications. Also, if you're pregnant or breastfeeding, not recommended. That's pretty much topping the list of who's not recommended. So what is required if you're going to be on these medications? So one of the things that you have to do is you have to get a blood tests, right? You need to get a baseline study. So the baseline tests that you should get is a comprehensive metabolic panel, a CMP, which evaluates the overall health and includes glucose and kidney function, hemoglobin A1C, which measures the average blood glucose over the past 3 months, liver function test, which assesses the liver health and detects any liver-related issues, fasting lipid profile to understand the cardiovascular risks, thyroid function test, which is a T3, a T4, a TSH. You want to rule out any thyroid-related complications. Okay, once you get on the medications, you have to be monitored with blood. Yes. Your A1C needs to be regulatory monitored to assess your blood glucose. Kidney function tests, which is like a CMP, need to be monitored to make sure your kidneys are functioning properly. You want to get your triglycerides and cholesterol levels evaluated during your weight loss journey. And electrolytes regularly assessed to make sure they're balanced, especially during those weight loss changes. Okay, what are some of the warning signs of blood tests? So if you're getting blood tests and you have elevated liver enzymes, and that could be potentially talking about liver damage, so you got to be very, very careful. Abnormal kidney function test, suggesting your kidneys might not be flushing properly, so you might have some problems starting there. And any significant alterations in your blood glucose, indicating the need for dose adjustment, right? You want to make sure you're not taking too much or too little. You have to get that evaluated. Okay. Now, let's jump into side effects. So what are the common side effects for these conditions? So let's talk about Mounjaro first. Mounjaro, again, tirzepatide. Common symptoms are nauseous, diarrhea, vomiting, reduction of appetite. Those are the 4 common symptoms. Ozempic and Wegovy, semaglutide. Common side effects are nauseous, diarrhea, constipation, and abdominal pain. So one of the things they've noticed recently, and again, these drugs are very, very new, and all the side effects and the effects are really coming to us live, right? So a lot of these drugs that people are taking for weight loss really haven't been vetted the normal way. And a lot of people are taking them and having success. So a lot more people are taking them. But one of the big things they started to find with Ozempic and Wegovy, that people get abdominal pain and constipation, and it could be significant for some patients. And it's something you really got to be careful of. If you're on these medications, you need to be very well hydrated. You're also going to want to counterbalance some of that constipation and abdominal pain with whether you have a stool softener or increased in fiber pills, right? You got to help your body flush and get things out, because the whole point of Ozempic and Wegovy is it's going to slow the body's elimination, right? Everything's going to slow down in your GI tract. So that's something you got to be careful of. Okay, let's talk about some uncommon side effects of these 2 medications. Let's hit Mounjaro first. Gallbladder disease is an uncommon. Pancreatitis, hypoglycemia. For Ozempic and Wegovy, the uncommon side effects are pretty similar. Gallbladder disease, pancreatitis, diabetic retinopathy, typically for those who have type 2 diabetes. Okay, so let's say you've gotten through that, you've started it, you're doing good. What are some of the results people can expect with this type of medications? All right, typical results. Weight loss. All right, okay, so let's talk about Mounjaro, tirzepatide. Clinical trials indicate an average weight reduction of 15 to 20% over 72 weeks. 72 weeks is almost a year and a half. Just so you keep your perspective. 72 weeks is almost a year and a half. Ozempic and Wegovy, users can expect a weight loss in the range from 10 to 15% over 68 weeks. Not quite a year and a half, maybe a year and a quarter. But a little bit less, right? 10 to 15 is a little bit less than 20%. What are some of the other things that you can expect? Glycemic control, significant reduction in A1C levels, often leading to better diabetes management. Atypical results, exceptional weight loss. Some individuals might experience greater weight loss due to individual metabolic responses. Minimal weight loss, non-responders or those with underlying conditions can have a slower effect and minimal weight loss. Okay. Now, let's get into understanding long-term use of these medications and how do you have sustained weight loss. Behavior intervention, right? Combining medications with lifestyle changes are very, very needed for long-term success. Regular monitoring, continuous monitoring of health markers to catch any adverse effects. What are some of the steps to take if you plateau with these medications? You're going to assess your dietary intake. What are you eating? Reevaluate your diet for hidden calories or nutritional imbalances. You want to increase your physical activity, incorporate more or a variety of forms of exercises. Medical review, you want to consistently consult with your healthcare provider to adjust your medication or dosages to explore alternate treatments. Okay, what are some of the steps to take after you reach your goal? Maintenance phase, right? You got there, great, way to go, great job. Now, how do you stay there? This is the question. How do you stay there? It's not easy, right? You got to the end of the marathon. How do you stay with your hands up and not go back to the starting line, right? That's the problem where a lot of people have. So let's get into the maintenance of this. Continue medications. Some individuals might need to stay on a low dose to maintain their weight loss. Ongoing monitoring, regular checkups to monitor your weight and health markers. Lifestyle adjustments, right? We have to keep and maintain a balanced diet, regular exercise. So just like anything else, there really is no secret of this. Part of it is these medications will they help you with decreasing your appetite, make you get fuller faster? Yes, definitely will. But you, the person, has to have responsibility for what you're actually eating, right? So there's no point in doing this and then going out and getting a hamburger, right? Or getting fried chicken and eating a plate of French fries. And, I mean, you really have to be smart about what you're doing and how you're doing it. Nobody could really expect that doing one thing by itself will solve the whole entire problem, right? The Staples easy button. While this does start you on the easy button way, it is not the end of it all. And it really, really is up to you, the person, to take the first step. And you have to exercise. Let's be realistic. You have to exercise. If you don't exercise, your results probably will be less than others. It is important. You need it. The Ozempic and the Wegovy, your muscle strength will fade. One of the things that we didn't talk about is how it affects muscles. Ozempic and Wegovy will affect your muscle tone. You have to exercise and you have to do weights, right? That is key. So in conclusion, navigating weight loss with these drugs can transform your life, but understanding the sciences behind these medications and identifying the right candidate for monitoring and being safe and knowing how to manage the side effects and plateaus are crucial for success. Always closely work with a healthcare provider to tailor a plan that suits your individual needs and ensures your sustainability for healthy weight loss. Because at the end of the day, it's up to you to do it, right? You have to be ready to do it. And you have to commit to yourself for good health. This will help you, but you still have to eat right, exercise. Be smart. Okay. As I always say, the opinions here are my opinions and my opinions alone. This information is not meant to be medical advice. If you are thinking about any of these programs, then please consult your physician. We do this in our clinic. We are starting this program. We have gotten such an outreach from patients to ask us to do it. We are starting this program and we have solutions, and every person is going to be a little bit different in what their solution is. And that is exactly how it should be. Getting your weight down, keeping the weight off your organs, keeping your cardiac health is super important. Let's be real, right? The heavier you are, the more struggle you're going to have on your organs. The less you weigh, the better your organs are going to feel, the better your knees are going to feel, the better your hips, the better your back, everything, right? That just makes sense. So be smart, be healthy. In life, health matters. Be well, be safe. Dr. Chillemi, till next time. If you enjoyed this episode, if this struck a chord with you, please hit that like and follow button. And if you know anybody that this can help, just give them some good information where they can get some of the facts in just a few minutes. Please pass this information along. Our goal is to help as many people as we can with as much information as we can. Till next time, be safe, be healthy, because health matters.